The next question is probably more contentious, and I have to point out that my approach to what the government has done with COVID has been very supportive, but I'm also science-based and asking questions, and it's been irritating to me that for some time my ability to question the Chief Health Officer has been zero. So the data I'm referring to is absolutely without the support of government information, which I greatly desire. So specifically looking at the vaccines, following on here from what Honourable Nick Oran has been saying, looking at the spending change for, here's at volume 1, page 310, spending change COVID-19 spending. What I'm looking at here is getting some measure of understanding, because if we're not being very precise with how we're managing the vaccine continuation, then as I mentioned in my budget reply speech, what we're seeing here is a concern, a risk, financial implications, both direct and indirect, costs to the community and the exchequer. Now, my non-specialist approach has been to look at the efficacy between 32 and 48% efficacy at preventing infection and between 37 and 73% preventing severe disease. So it certainly has efficacy. That's from February 2022, which is fine, but it's not particularly great, and it concerns me that we're overestimating the power of our vaccines to do the job they're paid for, or we've paid for. And the second is the waning efficacy over time, which is, I think, a major concern. We share that view as clinicians, I'm sure, over the population. And that is from March 2022, which suggested that we are actually looking at a fairly short-term protection over time, so there's waning efficacy, which hasn't yet, to my opinion, been properly assessed. And I've always told my patients, and indeed my colleagues here in the House, that 5 years later we'll look back and say what we should have done. So my question, through the Minister to the Chief Health Officer, is going to be, are we able to have the access to the information you provide to the government, so I at least can be reassured that this is the way scientifically we are supposed to be going?
Honourable Member, two things. The Chief Health Officer is a widely read individual. I've known him for a long time. I'm just not sure that he actually has read your budget reply speech. But you don't know, he may well have. But I suspect he may not have. So in respect to information that is held by government and is held as part of the cabinet process, then the answer to that is a straight up no. You will not get access to that information. I'm happy to ask the Chief Health Officer to provide you with any further information he's able to kind of have a technical discussion about some of the issues that you've raised. I'm happy for the Chief Health Officer to make some comments about that.
On the assumption, of course, that you haven't read the Honourable Member's budget reply speech.
Which I'm sure you haven't.
Which I admit I have not. No.
Average.
Through the Minister, so obviously I provide advice that is to government, that is released. The major formal advice is released in that way. There are other discussions that remain cabinet in confidence as part of that process. But I'm happy to discuss any specific questions that may arise.
The Honourable Brian Walker.
Thank you. And this last one very short. Again, in my budget reply speech, I did mention that we would be well advised, I think, to consider a pandemic-specific response rather than these emergencies carrying on, because we will expect this to be something of the future. And it would, I suspect, save the bottom line for our future budgets. Has there been any consideration, I ask the Minister, of implementing discussions on creating a specific pandemic response, much the same as they have in Victoria?
I'll get the Chief Health Officer to provide you with some advice on that. My recollection, Honourable Member, is that there is a discussion that's going on at a national level, perhaps about a pandemic strategy going into the future, but that just might have been someone proposing that, but I'm sure I heard some media coverage of that in the last couple of weeks. But I'll ask the Chief Health Officer to make some comments.
Through the Minister, so the strategies, as we start to transition from this pandemic, there is obviously work commencing on that transition phase, what that looks like. At a national level, that will obviously include consideration of how we the lessons we've learned from this pandemic and how we would translate them and prepare for a future pandemic. So a lot of the work we are starting to do now within the department is actually focused on ensuring that we have captured those lessons and that should we need to start this process again and move to that we can learn that as part of our planning going forward.
Thank you.